We know that despite all of the money and attention that has been given towards hyperacute and acute care, the best opportunity for functional outcomes in our stroke patients can be realized through stroke rehabilitation. Our staff are able to get into the home to see the client within 2 days, and usually it's within 1 day. We provide a short, intensive, specialized service. So for people who have a mild stroke, usually that means about a 4 to 6 week duration with early supported discharge. And for somebody with a moderate stroke, that means about a 6 to 8 week duration of service.
We use the transdisciplinary model of care, which means we sort of blend roles where it's appropriate to blend the roles. So if a speech therapist is working on certain communication skills and has some strategies that they want to use, then the rest of the team as well would be trying to incorporate those goals within their intervention. So we do that within what's appropriate, and each discipline still brings their expertise to the table.
It's very flexible. If there's a patient that needs a half an hour time of teaching, we can give it to them, or if they need, 2 hours time, we actually have that time to go into their home and actually do the teaching so they can benefit from the program.
In your clinic, you're always working on your client generalizing their skills from what you're doing in your clinic into, hopefully they can generalize that into their home setting. But with the early supported discharge team and working within their home, you've sort of taken out that step and you're able to work right in their environment where they need to use the skill most.
When clients are back in their home, they can see the things that they used to do before that they're now not able to do. So they might say, I'd really like to get to the grocery store and do my groceries, or I'd love to take my dog running in the park, or I'd like to get to the mailbox and get my mail. And so they're much more specific goals. And I think that in the hospital setting or an inpatient setting, we try to mock up what the home environment looks like to try to help clients sort of practice in as real of a setting as we can. But when we're in the home, this is really where we're practicing it. So we're really able to get the clients doing exactly what they were doing before in the environment they were before. And that makes a big difference, I think, to them, and being able to see that, yes, they can achieve those goals again.
It's really nice to see clients in their own environment and really get a good handle on their support systems, what they're really having difficulty with. You just don't always get that in other settings because you're not there. And here, because we are in the homes, we get a really good sense of what's going on with them. It's also, there's a lot of opportunities for myself professionally to grow because we are trying to work in a transdisciplinary model. I'm learning more about my colleagues' job descriptions and how I can do things to work towards their goals, which are really not their goals, but the client's goals.
We actually get to do community integration. So it's like you have this weight lifted off of you and you have freedom to actually go out there and take your client golfing if that's what they enjoy doing, or swimming to a program. You're not stuck inside behind a desk saying, there's this really great swimming program out there, you should get involved. I get to go and actively help them through it, which is a huge difference in rec therapy and one of the biggest reasons that I like being here.
The fact that therapists came to my home, I was able to do it in my own environment, for me, made it less intimidating. And I guess I found the tasks that I was given to do, I found them to be, I could do them with less inhibitions, if I could put it that way. So all in all, it was a very positive experience and helped, I believe, in a speedy recovery. Your program is wonderful. My wife didn't have to take time or lots of time off of work to see to my needs. She was here for the start of the program, the first couple of days, and after that she was able to pretty well get on with her life without having to worry about me.